Lisa, welcome to OC Breast Wellness.
Thank you.
I understand you have a history of breast cancer in your family.
Yes, my grandmother.
Let me ask you a question. If we could find breast cancer earlier, safely, painlessly, and without the use of ionizing radiation, would that be something you'd be interested in?
Yes.
Well, that's what we offer at OC Breast Wellness. As a matter of fact, we are the first to offer this combination in Orange County, to offer some new technology that is highly accurate, 94% positive predictive value, and it doesn't hurt. And we know right now whether there's any masses in your breast. Does that sound good to you?
It does.
Well, let's get started.
Let's go.
Lisa, I'd like to explain to you the very first test that we're going to do, which is a thermogram, a breast thermogram. Thermography just measures heat. And what we're going to do is use a very sophisticated camera, an infrared camera, that will convert temperature into color. Maybe the best way to explain it is through a picture. So I've got one here on the wall. This is a normal thermogram. The white is very hot, red is next. The coolest colors are greens and blues. And what we see on this is normal, this is all just normal blood vessels. This is just normal heat through here. Underneath the breast is obviously hot, and it picks up that heat. This is a normal thermogram. Let me show you a very abnormal thermogram that even you would recognize as being abnormal. There's really a breast over here on our right and her left. It just is a cool breast, and it shows up as the greens and the blues. Her right breast, though, is very hot. This is an inflammatory breast cancer, and you can see back in here the reds and the whites. Lisa, there's not one perfect test out there for breast cancer. So we're going to combine a physiological test, which is thermography, and an anatomical test. And this is a phenomenal test. It was developed at Harvard, highly accurate, 94% positive predictive value. This is painless. I like describing it as a clinical breast exam on steroids. We're going to run a device over your breast. It will feed that information into a computer, and we will see in real time any lumps and bumps in your breast, but we'll also be able to differentiate the hardness. And a cancer is typically very hard. And if there's a cancer growing in your breast that's larger than a pea, we're going to pick it up. Lisa, this probe has 192 sensors in it. It is 4 times more sensitive than human touch. You can see this on the screen to your left. Normal tissue has lumps and bumps. Normal glandular tissue, normal fibrocystic tissue is different than cancer. Cancers are hard as a walnut, and this will pick up anything over the size of 5 millimeters. That's about the size of a pea. Lisa, this is not you, but I want to show you what an abnormal test looks like. This is one we did earlier today at an oncologist's office. This is a 15 by 17 millimeter mass. Lisa, there's some great news. We saw no signs of any abnormality on the digital palpation imaging test. That's the anatomical test. Now, the thermographic test we send out to be read, and we'll get those results back in a couple of days. But right now, there's absolutely no sign of any abnormalities in your breasts.
That's exciting. I loved it. And most importantly, I loved the fact that it was pain-free. No squishing, no pinching, no ouch, no retake. It was great.
It's great. It's quite a relief, isn't it?
Yeah, it really is. I'm very relieved.
Would you recommend this to other women?
Absolutely. I can't wait to tell everyone I know.
Thanks.